Mic check, 1, 2.
Good afternoon, everybody. If you could all take your seats, please. Good afternoon, everybody. Madam Administrator, please let me know when you're ready. Thank you very much, Madam Administrator.
That's what I was trying to. That's right. I've been here for 10 years. I know enough. Right? So,
I tried to go down there like that.
We're going to call the meeting to order for Thursday, January 16th for the Appropriations Committee for the Block Grant Allocation Plan Amendment for review. It's an amendment to the FFY 25 Social Services Block Grant Allocation Plan. First, any comments?
No.
Madam Chair, any
No.
comments?
Good.
Representative Nuccio, any comments? No?
Sam?
No, all right, so, Representative Gilchrist, any comments? Senator Lesser, any comments? Representative Case, any comments? No, and who is the ranking member on the, is it you also? So you're,
On human services?
Yes.
No, thank God. No, I am in ranking on a not.
Senator Hurd.
Steve right now.
any comments, sir?
No, thank you.
Okay, great, thank you. Madam Commissioner, if you want to come up and give us a little bit of a dissertation and,
Brevity.
Madam Administrator, Representative Walker would like to see a little bit less mood lighting. Is there any way we can turn the lights on without?
No? Okay, I just figured everybody had a bad Wednesday night.
Okay. All right.
Commissioner, the floor is yours.
All right. Thank you.
All right,
Senator.
everybody, let's
Right.
pay attention.
Good afternoon, Chairs Austin, Walker, Gilchrist, and Lesser, and Ranking Members Summers, Nuccio, Harding, and Case, and distinguished members of the Appropriations and Human Services Committees. I am Andrea Barton Reeves, and I'm the Commissioner for the Department of Social Services. And today I'm here to request change to the, to the SSBG allocation plan you voted on in September of 2024 to spend $500,000 of our carryover to provide additional support to Planned Parenthood for family planning services. They provide vital care to more than 50,000 individuals in our state, many of whom are uninsured and rely on Planned Parenthood almost exclusively as their primary source of health care. These are individuals that are from low-income households, and they do face significant barriers to accessing critical care and preventive services. And without this additional assistance, Planned Parenthood may need to reduce hours, limit appointments, and potentially close clinics entirely directing and impacting access to care and placing the health and well-being of many Connecticut residents who rely on their care at risk. So recognizing this urgent need, the organization sought state support to help address the critical financial gap in delivering basic health care to vulnerable populations. And in conjunction with our colleagues in the legislature, we have identified resources that are within our social services block grant to support this critical service provider. This funding, it does not diminish any other available resources in any way to the other 80 or more organizations that receive funding through SSBG, but instead it draws from our carry forward fund, which which exists to ensure immediate continuity of essential services for those who need it most. It is in fact a strategic investment in our health and welfare. So according to the SSBG requirements, this contract specifically supports individuals and families with incomes that are 150% of the federal poverty level, and that is about $46,800 for a family of four. And it eliminates the barrier of costs by not requiring patients to have any resources in advance in order to access care. And also, I think what's important here is that the services under this contract, they do include comprehensive and confidential care. And there's a specific definition of what family planning means under this grant, and I will review that in a moment. It's important also to note that these services are already approved under our current allocation plan, which also passed with strong bipartisan support just a few months ago. This particular adjustment only increases and adjusts that particular line item for this particular provider, and there's no change at all in the scope of the services that they will be providing under the current contract. We also would like to note that this is not a unique circumstance, that one-time funding adjustments are actually quite routine to make sure that there is continuity of services in critical sectors. We had recently adjusted the plan to include a $185,000 one-time temporary stabilization for Meals on Wheels during the pandemic to subsidize when there were lower levels of subsidies and federal funds available then. And those subsidies were needed because there was a reduction in funding in the Older Americans Act. And we also provided an additional $8,000 at one time for shelters to respond to the increased demand for eviction prevention and stabilization when there was a lifting of the eviction moratorium. So these SSBG adjustments are normally done or commonly done through the annual allocation process, but in order to ensure healthcare access without reduction or disruption, it is important to address this now rather than wait for next year's allocation plan. So this funding request represents our collective commitment to safeguard access to critical care for Connecticut's most vulnerable residents. And I do urge your continued support in upholding the dignity and, the health of those who rely on these essential services. And I thank you for that. And I'm here with my colleague, Deputy Commissioner Peter Hadler, whose organization we call internally POGA, is also responsible for the administration of this grant. And we're happy to answer any questions you may have.
Thank you very much, Commissioner. I have one question. Relative to the use of this funds, these are federal, these are federal dollars.
Yes, these are federal dollars.
And so federal dollars cannot be used for abortion-related services, is that
No.
correct?
No, they cannot. And actually what I will do, if you'll indulge me, I will read the definition of what it can be used for under family planning. I won't read the whole thing. It's a long paragraph, but I'll highlight
Thank
some
you.
of them. Okay. It includes educational, comprehensive medical or social services and activities which enable individuals to determine freely the number and spacing of their children. It also includes a broad range of acceptable and effective methods to limit or enhance fertility. It can include contraceptive methods, and specific components and services of activities may also include preconceptual counseling, education, general reproductive health, which is really the focus that we have here today, is the general reproductive health, including the diagnosis and treatment of infections which threaten reproductive capability. That is what is covered under the general definition of family planning services under the SSBG grant.
Thank you, Commissioner. Representative Walker, do you have any questions currently? Representative Gilchrist, do you have any questions currently? Senator Lesser. Senator Summers, any questions currently? Representative Case.
Thank you, Madam Chair. Good afternoon, Commissioner.
Good morning, Representative.
So this came to us and I had some questions and I pulled some stuff on the SBBG services grant. And this grant, I'm just curious, I want to make a few statements, then have a few questions because I'm kind of curious how this number came and why it came for that.
Excuse me, Representative Case, just to clarify so everybody knows this ahead of time, not intended for Representative Case. 2 questions per person. You can always come back and ask a 3rd or 4th question after that, but limit your questions to 2 right now, please. Thank you.
That's how I learned over the years. So I make a statement first to make sure they're all inclusive.
Yes, no, I'm gonna stop that too.
We 14 years, you learn a little bit. So, Commissioner, there's a lot of different things when the SBBG grant that can be done, and some things concern me. I mean, we're going to put it towards one agency that's outside of state government, but we also can, through this grant, provide to community action agencies, to municipalities, for homeless operations, for people who are sitting outside, independent living. They're always hurting for money within our budget. We can actually put money there. Delivered Meals on Wheels, as you said, it was chosen during there. Meals on Wheels is really dire straits right now. We need monies from Meals on Wheels. That's an agency that actually feeds everybody throughout our state that needs food brought to their home. There are many things throughout the substance abuse services in the state of Connecticut. We have a lot of mental health issues, and that is one of the things that can be funded through this. Human service infrastructure through DSS is screaming for money. We are hurting. People are hurting. One question, I guess I'll ask it straightforward. Why one agency? Why $500,000? Somebody already gets $843,000 or so is going to move up to $1.4 million when we still have people living on the street with mental health issues. And those are places that are able to be funded with this money. And why are we here so early in the session? We haven't even begun meetings yet.
So thank you. I should have written, because you had a number of questions. I want to make sure that I address all of them. So the question is, why right now? Planned Parenthood is unique with respect to the other organizations which are extremely important. So please hear me very clearly. I am not diminishing the importance of any of the agencies that we fund. And I am very, very conscious of the needs across the board. But Planned Parenthood is unique in the fact that it is the only agency that actually provides family planning to the extent that it does. And that is why when they came to us and said, we need some more support, because what we are hearing, and this is the ask of us, that we have a number of people who are concerned that there will be reductions in support in areas, particularly rural areas, where people cannot get access to reproductive care. And when we're talking about reproductive care, excuse me, particularly, we're talking about, in particular, early detection of cancers and other kinds of diseases that women in specific areas, particularly rural areas, and this is supported by not just me saying this, there are CDC reports that actually speak to this, that having that care and that access helps to save lives. So in this particular instance, when Planned Parenthood said, we are really seeing a significant increase in the number of people that we are seeing. And we're particularly interested in, I shouldn't say interested, we are particularly hearing from our constituents in our rural areas that are not really, they're concerned that they're not going to be able to have access to care. Not really sure what's driving that concern. It could be a change in federal administration. It could be any number of things. We don't really know, but they know that they're seeing it. And so in order to address that particular issue, they have come and they've asked for this funding, and this is the area in which we have that funding that's available to them. And that is why we're here before you today. It has more to do, I think, with the timing of the ask, because there is a concern that there might not be funds that are available. And so that's why they've come to us now, and that's why we're coming to you now.
Commissioner, and I appreciate that. And nothing away from the care. My concern is, I know you shut us all off, or somebody did. So my last comment, it's not a question, but we have 18% more people sleeping on the streets. That's happening today. This is for care down the road. That's happening today. We are hurting. Mental health is hurting. Give $250 here, $250 we cut $500,000 from cold weather shelter.
I'm not trying to shut you off. I pushed the wrong button.
Jeez.
It was,
I wonder why I don't go back on appropriations.
it was, I don't know. It was not a Freudian slip. I promise you it was not.
So I guess that's where my frustration is. Why one number to one organization when we're talking about people who are sleeping on the streets, 18% increase in homelessness. We cut $500,000 out of the $5 million line item for cold weather shelters. Yeah, we're giving somebody else $500,000 when you walk down the street and people are sleeping outside. I just can't support it.
Commissioner, there is no question there. That was a political comment that my colleague made. Representative Ackert.
Thank you, Madam Chair. And Commissioner, good to see you, and thank you for being here.
Thank you.
Quick two questions.
Certainly.
The carryover, where's the carryover funds come from? When it says, when you say carry, where's that? Just so I understand where it's coming from.
I should really, and this is where Deputy Commissioner Hadler always corrects me. It's carry forward, not carry over. So I want to make sure that I'm using the right term. It's carry forward. It is a percentage of the overall grant that essentially we hold back in the event that there is a need such as this one that comes forward. We also hold it back because there's often a time that lapses, or say there's a lapse in time from the time that we get our SSBG funds and the time that they're actually allocated by the federal government. But often our organizations need those funds before we actually get our funding from the federal government, and we use that carry forward for that purpose, to fill in that gap. So it really serves two purposes, the carry
Okay,
forward.
and those, just to back up the first question, that's federal funding.
Yes, it is.
Great.
That's
And-
correct.
And then the second question I have is, looking at the 2023 allocation, I'm questioning why we had essentially 1.25 million budgeted in 23, and then in 24, we dropped substantially lower to 924. Why was, in terms of the need that we're now jumping to 1.4,
Yes.
why was there such a reduction in the funding to begin with?
Yeah, please.
Hi, happy to help try to answer that question. Peter Hadler, Deputy Commissioner at DSS. Thank you, Representative. That actually has more to do with the timing of when bills are being paid across a fiscal year. So the expenditures that were, the way they've lined up, they appear to have showing a demonstration of up and down, but in fact, the total amount that was being provided across those 2 years was level.
Okay. I appreciate that. It seems like there's a more need, though, rather than it was kind of was interesting with why. Do we know where the 24 numbers are going to end up? Great question. Actually, that was the backup to the first. Sorry, and that's my last question.
Well,
Yeah.
And you can get back with me on that if need be.
it may
you
need
go.
to, but conceptually, right, we're budgeting an amount of money to be spent on these services within the SSBG framework. And so the numbers that you're seeing, the $922,000 total that's under family planning and the block grant to start out with, plus this additional 500,000, that would be the budget for this fiscal year to, provide the services that are identified.
Thank you, Deputy Commissioner, and thank you, Madam Chair.
Thank you. Representative Nuccio.
Thank you, Madam Chair. So Commissioner, I have a question. When we started talking about this earlier, I spoke to
Representative Nuccio, can you turn your computer up a bit? It's hard to hear you.
I don't know how to do that, but sure.
Just the volume,
Is that better?
a little bit better. You may need to go close to the computer.
I need to get my head. Is that better?
Yes.
Okay. All right. So I have a quick question. Earlier this week, I was speaking to Senator Austin specifically about this meeting coming up. I actually spoke to the lobbyist from Planned Parenthood because one of the things that I had heard was that this money was just in case funds wouldn't be available. And when I spoke to the lobbyist, they said that wasn't the case, that this was for direct need. But you just said that there was concern that funds would not be available. Can you please clarify that? Because now I'm hearing two totally different things on the usage of this money.
Thank you, Representative, for your question. I think that the lobbyists and I are probably saying the same thing in different ways. It is for direct care.
But
And
is it for, oh, I'm sorry. Go
no,
ahead.
please finish your question.
So is it for direct care that we know right now we have the demand for it, right? We are overbooked. We don't have enough appointments and everything else, right? Because this is women's health issues. I'm absolutely concerned about that. But if this is money that is just in case the federal administration does something, I find that a little harder to support because it's just in case, right? There are a lot of, as Rep. Kay said, a lot of just in case things that we could support. So I really want to be very, very clear. Is this for demand that we know we have in the rural areas? And I was wondering which rural areas, because when I read the one pager, again, they're talking about more city areas than they are in the rural areas, that we have demand for these services. And we need to open up more appointments. I really need to be clear on this, please.
Yes, okay. So Both of those things are true. So there is demand in the rural areas and there's also demand in the cities. There's no question about that. The demand has risen. What I was speaking to is that when their constituents or their patients, I'll call them, come to see them, they're also expressing concern that there might not be an opportunity for them to have demand, for them to have access in the future. But that's what their constituents are saying. That's not necessarily the same message that Planned Parenthood has. So what I'm saying to you now today is that we are talking about increased demand for services that are happening today that people need in rural areas, in cities. Where it's particularly acute in rural areas because we don't have the same kinds of access to resources that we do in cities. So part of this is you hearing me sort of overlay what I'm seeing, not just in the area of Planned Parenthood, but just across the board, right? Sitting in the seat that we and Deputy Commissioner Hadler see and where we see the need. But in the area of family planning, as it relates to this grant, there is increased need. There is no question about it. Planned Parenthood is absolutely right. There's no doubt about that. And that's what these resources would be used for.
Okay, so that makes a lot more sense to me. The way that you just said that, I just wanted that to be very clear because honestly, if you were coming forward to me and saying Planned Parenthood wants $500,000 just because they think, you know, something may happen with the federal administration and, you know, we want to have our backs covered for that, I'd be a hard no on this, right? But
Understood.
you're saying, when I understand this now, constituents are worried that there might be a funding issue going forward. So we're
Right.
seeing more people actually coming in for services to Planned Parenthood, more affordable services through Planned Parenthood, which is
Correct.
driving the increase and why we need to give them more money. Is that
Correct.
correct? All right. Okay.
So-
That makes a heck of a lot more sense to me. And I
Okay.
appreciate that information. Thank you.
All right. Thank you.
Thank you, Representative. Representative Nolan.
Thank you, Madam Chair. Good morning.
Good morning.
Good morning, sir. I just want, if we can just rewind back to when you started. Unfortunately, I was walking in the door at the beginning, and I just want to make sure that we understand the increased demand for services. Can you be specific about what the increased demands are? What areas that they're going to be trying to work to use this funding for?
Yes, yes. So it is both in rural areas and the larger cities. But very specifically, so Planned Parenthood is in 15, they're in 15 towns in Connecticut and one in Rhode Island. That's considered the Planned Parenthood of New England. We're really more concerned about the 15 that are in the state of Connecticut. So when I had this discussion with Planned Parenthood, there was a particular concern about a few areas, one of which was Bridgeport. The other is New London, the other is Torrington and Willimantic. So we're talking large cities and small cities where we're seeing greater demand for the reasons that let me get into the microphone. I apologize. Those are just a few where they are anecdotally seeing larger demand and people coming in saying, I'm not sure if I'll be able to come for my reproductive health services, after some period of time. So they're seeing a significant increase of people coming. These are some of the cities that they've known. I can get the full list for you, but these are the ones that I know that we've spoken of with Planned Parenthood. Because we
Okay.
asked the same question.
Yeah, a few of us would be interested in more of the specifics of
Okay.
what the services are.
Certainly.
In regards to
Okay.
when it says increased demand,
Yes.
what is increasing? What areas are increasing that they're going to be using the funds for? Obviously, they're talking
Yes.
about reproductive
So-
health, but
Yeah.
you talked about cancer.
I
some
did. So
cancer services
I can
earlier.
start to answer some of that for you if that's helpful. What is really unique about the Planned Parenthood patient mix is that they often do not have primary care providers. So Planned Parenthood is their primary care provider. And they are also the one agency in the state that provides for reproductive health. And that does include Pap smears, screening for cervical cancer, screening for ovarian cancer, screening for breast cancer, screening for sexually transmitted infections, because some of them are teenagers and that's what they do. So that, there's a place for teenagers to go and for young adults to go. So we're talking 18 and older, right? 25, 26, where they can go in. And it's also some of that constituency, the younger constituency, that are feeling like this is the place where I go. I have privacy. My parents don't need to know. It's not the same doctor that my mom or my dad might have, or they may be in a family that has never had a primary care provider. And this is access to care that is really valuable to this low income and poor community that Planned Parenthood serves pretty much exclusively in this area of reproductive health. That's what they're hearing from their constituents. These are some of the areas in which they are hearing that. So it is really more than just coming in and saying, I think I'm not going to be able to get my regular exam. It is, they're serving in many ways as their primary care physician and looking at their health holistically. And so without that additional support, there will be numbers of people who will either not go or not be able to get care or have to wait much longer because there's no capacity to see the increased numbers of people who are coming.
Okay, and
Also,
question number 2.
you've already asked it too. Can you
Was that
come
two?
back for your third? Yes, you
Yeah,
did.
you said-
Yes, you did. You tried to
I mean,
slide
did
some in.
I?
Yes. I'm not going to treat you any different than Representative
I knew all the
Ackert.
talking that was going on.
No. No, we'll be back to you.
All right.
Representative Master Francesco, followed by Representative Dathan.
Thank you, Senator Austin. Thank you, Commissioner, for being here. I appreciate it. Certainly always appreciate your testimony and you're very thorough. I may not always agree, but I certainly appreciate what you put into it. I want to just kind of echo what our good ranking member JK said, and I certainly agree with him 100% on the concerns and the needs for other people in our community that are certainly suffering. And also with Representative Gibson made a really good point is that, we would like to know how many services they provide and exactly what they're doing with state money. So with regards to Planned Parenthood, do we know, or do they send a report to the Committee of Cognizance of how many services they perform in each area on a yearly basis? And I ask that because they are getting federal money, state money, and I think for transparency, people want to know what that money is being used for. So, without breaking any HIPAA laws or anything like that, how many mammograms do they do a year? How many pap smears do they do a year? How many abortions are they providing per year? Do we get an annual report from them?
I do have a preliminary list in front of me of the number of visits that fit into different categories. We do not ask about abortions because we do not cover that. So we don't ask for those numbers, but I can tell you right now that their total visits are 102,343. They serve 47,252 people who identify as female and 6,843 people who identify as male. Primarily, they serve the groups that are between the ages of 20 and 39. Their patient mix is 88% female, 96% 19 and older, and 67% Hispanic and Black. With respect to the number of visits that are provided, these are the numbers that I have, and I'm certainly I would be happy to provide more detail. The initial annual visits this is between September and October of 2024 are 300. For general medical care, they have been seeing 5,490 people. For IUD implantation, which they can do with SSBG dollars, they have seen 330 people, and then they have done some small amount of pregnancy testing with 64 people. So those are the visits those are the statistics that I have regarding the number of visits that have been made. I'm sorry, between October 23 and September 2024.
Excuse me, Commissioner, Representative Master Francesco, just for the record, Representative Gibson is not here today. I think you may mean Representative Nolan, but I'm not certain who you were referencing.
Thank you. It could have been who was on the screen asking the questions the last time. Thank you for
I'm
that.
sorry, Gibson is online, Kathy. That's why. So she
Oh,
sees him on the screen here, right, Rep Gibson?
Okay, thank you. Thank you for that answer. If you can send that information, or maybe it was in your packet and I just missed it. And I know I only have one more question, so I want to make it. I want to be creative and try to put it into two. No. So my last question, actually, my concern is obviously these numbers are very important. People want to know. I understand why you're telling me that they don't report abortions because federal money cannot be used for it, but apparently I'm pretty certain that they can use state funding if the state was funding it. That's another thing. The other question I have is, Planned Parenthood a mandated reporter to report sex trafficking or child abuse?
I don't know whether or not they are a mandated reporter, but I do know, and this is very anecdotally, this is not something Planned Parenthood shared with me, that if they suspect it, they have ways of reporting it. And if you've ever visited a Planned Parenthood site there, which I did maybe about a year ago, there are a lot of posters that are up about sexual trafficking and domestic violence. This is just part of their overall mission.
Right, okay, but we don't know for certain if they are mandated reporters.
I don't know for
Oh,
certain. I can certainly find out. for
Okay.
you.
All medical providers are mandated reporters.
Okay, thank you. All right.
Thank you. Thank you, Madam Chair.
Representative. Up next is Representative Walker, followed by Senator Summers.
Thank you. Thank you, Commissioner, and thank you for your testimony here today. After listening to some of the questions, I would like to sort of have you just state, in order for us to get to this point where we have a hearing, who are the people that charge us to have a hearing and the subject matter?
Oh, okay, certainly I can answer that.
Mhm.
So when the need was brought to our attention, this is a hearing that is statutorily mandated,
Mhm.
that if there's any change in, excuse me, any SSBG line item that exceeds $50,000 or 10% of a particular allocation, the statute that enables our legislative body to approve the grant also has an obligation to hold a hearing. So that is why we are here today.
Okay, I guess maybe I should have been a little closer, but
I
this will be my second part.
Okay.
So it's only two. Um,
Okay.
In order for us to call the hearing, we have to have it come from a particular entity in our government system.
Yes,
And it is also signed off by two other people in the government system. So
correct.
it is originated by whom?
It is originated by the Office of the Governor.
Yeah.
So that is also statutorily required that a letter come from the Office of the Governor
Mhm.
to legislative leadership, and then a determination is made to hold a hearing, and that is why we are here today.
Thank you, ma'am. Thank
You're
you.
welcome.
Thank you.
Senator Summers.
Yes, good afternoon. I have two quick
Afternoon.
questions.
Absolutely.
On the block grant that has a carryover, after these funds are allocated, if they're allocated today, is there additional funds that other areas, whether it's homelessness or mental health, could then come to you and say they need additional funding and go to the governor's office, and we would be doing this for other areas? That's the first question. The second
Okay.
question is, if you could just confirm, it's my understanding that if this funding passes today, it's not a check, so to speak, that Planned Parenthood gets $500,000. It's a reimbursement for the services that they're providing. So as they provide, I don't know if they do it on a monthly basis, they provide and then they are reimbursed. Is that correct?
That is how that is how our process works. Thank you, Senator. So to answer your first question, certainly any of the organizations that receive funding under the SSBG can certainly approach the governor's office, DSS, and ask for a change in their allocation. They can certainly do that. That is usually done through the hearing process that we're in today. If we make the change that's outside of the $50,000 or the 10%. So yes, that is definitely, any organization can do that.
He didn't answer my one question.
I'm
If
so
this is
sorry.
allocated today,
Yes.
what will the balance be that is still?
Ah, okay. Yeah. You know that
Sorry.
number?
Yeah, I think we'll have to take that back to see where we are. Again, it's sort of a rolling number, as you referenced. We're
Right.
constantly looking at many providers who utilize the funding and provide expenditure reports. So we have to track all of those expenses against the budget on a rolling basis, but we can try to identify where we are and provide that information to you.
Senator Harding.
Thank you, Madam Chair. Good morning. Thank you, or good afternoon, I should say. Thank you for your testimony so far and your information. In terms of the process for this, so, and I apologize if you had testified to this earlier, but I didn't hear it. So I'm assuming Planned Parenthood came to you and requested this funding. How did that process work?
Yes, so Planned Parenthood, as every other provider, as Senator Summers has said, and has happened in the past, just so we know, yes, a provider can come and they can say that they need additional funding and resources for a particular need that is covered under the reasons that this particular grant covers. So in this instance, that conversation certainly was had. Planned Parenthood did approach us, did explain their need, they explained what they were hearing from their constituents, were explaining the increase in the demand that they were experiencing and the need for additional resources in order to meet that demand.
And thank you. And if, is it 2-question limit? Is that how this operates? I'm new to this committee.
Yeah, yes, Senator, but you are a leader of your caucus, so please
No,
continue.
I appreciate it. I don't want special.
You cannot
I-
object.
Thank you. I'm going to ask one more. I'm going to follow the rules. Thank you, Madam Chair. So the last question that I have is, did any other my understanding with this grant or this block of money, there's a significant amount of social services that utilize this funding for their services they provide.
Yes.
And you're saying that Planned Parenthood came to you and asked for this money. I know that there are a lot of departments and a lot of social services that are really, really strapped for cash right now.
Yes.
So I'm assuming there's no other agency that has come to you then and asked for additional funding?
Not under this grant. No, there hasn't been any other agency.
Okay,
No.
thank you.
Thank you. Representative Meskers?
Thank you, Madam Chair. I just want to thank you for your testimony. I think I heard within the commentaries questions about the nature of the services provided,
Yes.
and I thought you adequately addressed that issue. And I'm favorably disposed towards Planned Parenthood, but I guess the question I'll ask, and you don't need it today, but I'm concerned about the distribution of services rendered within the state, because we did have that commentary early on between urban and rural. And I want to make sure that we're attending the needs of all the constituents to the best of our ability. So I don't know if we have a breakdown, both in Planned Parenthood, in the incremental block. Is this going to be principally in urban areas? And it's not an objection. But I want to make sure that we do have some level, given its pap smears, mammograms and all. I don't know if you're prepared to answer that now or in the future, but I want to make sure that we've got a wide display of those services rendered in the state.
Yeah. All right. Thank you. I will get you the services by each office and each site.
Yeah.
Yes, I think that's what you're asking for.
Perfect. I think it's a big question. That's why I didn't want to ambush. I think
Understand.
going forward, I think as we look at the needs of the state this year, has to be one of the focuses, whatever the resources we have, that they're equitably distributed. So, but thank you for the testimony. Thank you, Madam Chair.
Thank you. Currently, there are no other questions. Representative Ackert?
Thank you, Madam Chair. I appreciate it for the second time. And I thank you again, Commissioner and Deputy Commissioner. Just, I guess, a follow-up to the funding component. So at this point, we're asking for $500,000 on the carry forward dollars. Is there additional carry forward dollars out there that are available for the other block grant line items here?
There are, yes. Obviously, it is, as Deputy Commissioner said, it's a rolling number because it's done on a sort of an invoice basis. So we have to keep track of that, and I can get you the exact number. But there are additional, we don't exhaust the carry forward for the reasons that I mentioned earlier. So there are other dollars available.
Great. Thank you very much.
You're
Appreciate
welcome.
that. Thank you, Madam Chair.
Thank you. Are there any other questions? Representative Case? And remember, everybody will have a caucus after this. The House Republicans will be having, or the Republican caucus will be in room 2D. So they'll get a chance. I'm sorry. Sorry, sir. Yes. Representative Case.
Thank you, Madam Chair, and thank you, Commissioner. So I guess it's who lobbies and who comes first to question, but my concern is we have lots of press conferences in here, and the one thing that I really work on is people's lives. I understand this issue is something that needs to be taken care of. But within this allotment, the press conferences around here on homelessness, on food, on everything else, that's allowable. But because they didn't lobby you, they don't get a piece of this. So now we need to get them to come to you. Is that correct? Because there have been press conferences and people are living on the streets. And that is something I think that we need to fund now. If there's $500,000, let's take that 4.5 million we gave to cold weather and make it the 5 million that it was last year. Because that's an immediate need. And that's what I'd be approving today.
Thank you, Representative Case, for that comment, not question. Thank you. Appreciate it. Seeing no other questions, we're going to close the public hearing. And in room 2D, there will be a Republican caucus, and we will presumably coming back in 30 minutes, 30 minutes, and we'll see what'll happen. Thank you.
Thank you.
All right, thank you.
Ajá. Ah, pues no tiene que venir. Ok. Sí, 50, yo creo que son 55 de adelante. Um, she could, but no le. Sí, el descuento no, que nada.
Juan, mute yourself.
Mute yourself, Juan.
Yeah, it's on the calendar. Guess I'm
So good afternoon, everybody. We are going to reconvene at 1:30. We are going to take another 22 minutes. We're going to reconvene at 1:30. Good afternoon, everybody. We can start heading towards our seats now. We can start heading towards our seats. Hello, everybody. We can start heading towards our seat, please. We're going to be deliberative on getting to our seats now and voting in a few minutes, maybe. Matt's coming back too. He's fine. He is coming back. I did. Yeah. Yep.
Do that. Oh, come on, honey.
It is. Sorry, thank you. We're just having a few more people meander in. Here we are. Somebody want to poke their head out the door, see if Senator Lesser's in the hallway? All right, here we go. We're going to convene the meeting and this is going to be turned over to the Human Services Committee. Senator Lesser, are you ready?
I am ready, Madam Chair. Madam Chair, I'd like to ask for a motion and a second to approve the proposed amendment to the federal fiscal year 25 social services block grant allocation plan.
So move.
By
Senator
Representative
Anwar.
Nathan, second by Senator Anwar. Is there discussion? Yes, Representative Kate.
Thank you, Mr. Chair. And I appreciate the time and we're here to vote today on something. And I just want to say, I have nothing against what the agency decides where the money goes, but there are so many imminent things that we talk about in human services that really need an influx of money also. And I will be voting against this today, hoping we can get some of the other carry forward money or this moving to agencies, especially since we have such a huge population out in our communities sleeping outside at night. And I respectfully will have to vote no, but I thank you, Mr. Chair, for the time.
Thank you, Representative Case. Any other discussion? Seeing no discussion, clerk will please call the roll.
Representative Gilchrist,
Yes.
Senator Lesser,
Senator Lesser, yes.
Representative Case,
Representative Case, no.
Senator Harding,
No.
Representative Comey,
Yes.
Senator Mara,
Senator Mar votes yes.
Senator Anwar,
Senator Anwar votes yes.
Representative Butler,
Representative Butler votes yes.
Representative Dathan, Representative D'Amico,
D'Amico votes yes.
Representative Fortier,
Fortier votes yes.
Senator Gaston, Senator Gaston, Representative Hughes,
Representative Hughes votes yes.
Residential care homes.
Representative Johnson,
Representative Johnson votes yes.
Representative Kit,
Representative Kit votes yes.
Representative Master Francesco,
Representative Mastro Francesco votes no.
Representative Meskers,
Representative Meskers votes yes.
Representative Pizzuto,
Rep. Pizzuto votes no.
Representative Santiago,
Santiago votes yes.
Representative Scott,
No.
Representative Shake,
Representative Shake votes yes.
Representative Stewart, Representative Stewart, Representative Vale. I will now tally.
Did you forget about Senator McCory? Is this appropriations?
This is Human Services.
Okay, so
Votes will not be left open today, so if you are on the Human Services Committee and you have not voted yet, this is your last opportunity. Seeing no hands up, the clerk will please announce the tally.
The tally is 15 yay, 6 nay, 1 absent.
Okay, Human Services will now recess.
We're going to open up the appropriations part of this meeting. I'll entertain a motion and a second to approve the proposed amendment to federal fiscal year 25 social services block grant allocation plan. Is there a motion?
Second.
Moved by Representative Walker, seconded by Senator Lesser. Is there any discussion? Does anybody have any discussion? Seeing no discussion, Madam Administrator, could you call the roll, please?
Senator Austin,
Senator Austin votes in the affirmative.
Representative Walker, Senator Hartley, Senator Kushner,
Senator Kushner votes yes.
Representative Exum,
Representative Exum votes yes.
Representative Paris,
Representative Paris votes yes.
Senator Summers,
Summers votes yes.
Representative Nuccio,
Representative Nuccio votes yes.
Representative Ackert,
Rep. Acker votes yes.
Senator Anwar,
Senator Anwar votes yes.
Representative Baker,
Representative Baker votes yes.
Representative Belton.
Yes.
I can't, you need to vote again, please, ma'am.
Yes.
Everybody, if you could just, the Madam Administrator has to hear everybody that's voting and making sure she's seeing them. So if we could keep our conversations to a minimum, and if you need to have one, you can go out in the hallway. Thank you.
Representative Belton?
Belton votes yes.
Thank you, ma'am. Representative Berthel, Representative Belinsky,
Representative Belinsky votes yes.
Representative Brown,
Representative Brown votes in the affirmative.
Representative Candelaria,
Representative Candelaria votes yes.
Representative Corpus,
Representative Corpus votes yes.
Representative Dathan, Representative DiCaprio.
Representative DiCaprio votes no.
Representative DeFranco.
Yes.
Representative Delaney. Representative Del Nicky. Representative Dillon.
Dillon votes yes.
Representative Felipe.
Yes.
Senator Flexer. Representative Foncello.
Monticello votes no.
Representative Garabay.
Garabay votes yes.
Representative Gibson.
Representative Gibson votes yes.
Representative Gilchrist.
Yes.
Representative Gonzalez. Senator Gordon.
Senator Gordon votes yes.
Representative Haddad. Senator Harding. Representative Hoxa. Representative Johnson.
Representative Johnson votes yes.
Representative Cavros DeGraw.
Representative Cavros DeGraw votes yes.
Representative Kennedy.
Kennedy votes yes.
Representative Khan. Representative Leeper.
Leeper votes yes.
Senator Lesser.
Senator Lesser votes yes.
Representative Martinez.
Representative Martinez votes yes.
Senator Marks.
Marks votes yes.
Representative McCarthy Vahey.
Representative McCarthy Vahey votes yes.
Senator McCrory, good afternoon, sir.
McCory votes yes.
Thank you.
All right.
Nailed it.
Representative Nolan.
Nolan in the affirmative.
Representative Pavlak D'Amato. I'm sorry, I need to see you, ma'am. Where are you? Oh, there you are. Hey. Nice to see you. Representative Reyes. Representative Rosario.
Representative Rosario votes in the affirmative.
Representative Ryan.
Representative Ryan votes yes.
Representative Manny Sanchez.
Sanchez votes yes.
Thank you. Representative James Sanchez.
Representative James Sanchez votes yes.
Thank you, sir. Representative Sims.
Representative Sims votes in the affirmative.
Senator Slapp. Representative Winfield. Senator Winfield. Oh my gosh, I'm sorry. Senator Winfield. Oh, I don't blame you if you don't answer me after that. Senator Hartley. Senator Hartley, I saw you.
Hi, Senator Hartley in the affirmative.
Thank you, ma'am. Senator Berthel. Good afternoon, sir. Representative Delaney, are you with us? Representative Gonzalez? Representative Hoxa? Representative Khan? Senator Winfield? He froze. Senator Winfield, we cannot hear you. We can see you, but we can't hear you. Golly. All right, I'm going to count the tally very slowly.
Can you hear me now?
Yes.
Okay.
Now I can see you though.
Can you?
Yay.
All right. Senator Winfield,
Quickly, Senator Winfield.
Senator Winfield, in the affirmative.
Yes. Thank you, sir.
Thank you.
Ready, Madam Chair.
Madam Administrator, are you all set?
Yes, ma'am, I am.
What is the tally?
Total number voting 50, those voting yea 46, those voting nay 4, those abstaining 0, those absent not voting 0. I mean, 4. Sorry.
Thank you, Madam Administrator. The motion carries. I would like to entertain a motion to adjourn.
So moved.
Second.
Moved by Representative Walker,
Got it,
seconded
got it.
by Senator Summers. All those in favor indicate by saying aye.
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 Opposed, any abstention, motion carries. Senator Lesser.
Thank you, Madam Chair. At this point, I'd like to reconvene the meeting of the Human Services Committee, and I'd like to ask for a motion at this time and a second to adjourn the meeting. Motion by Representative Gilchrist, second by Senator Marr. All in favor? Aye.
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 It's adjourned.
Madam Administrator, can you let me know if we have any other business before us?
We do not, Madam Chair. The next time I anticipate us getting together will be on February 6th for Secretary Beckham's briefing.
Thank you very much.